Hello, my name is Dr. Ravi Gandhi. I'm a board-certified neurosurgeon and I subspecialize in brain tumors, skull-based neurosurgery, and cerebrovascular diseases. One of those cerebrovascular diseases that I commonly treat are brain aneurysms. A brain aneurysm is an abnormality that arises off the blood vessel wall in the brain. Most commonly, brain aneurysms occur where blood vessels split into two branches or three branches. When we find an aneurysm incidentally or before it has ruptured, we then have to take into consideration very seriously whether this aneurysm needs to be treated or not. The things that we take into consideration are the size of the aneurysm, patient-specific characteristics such as age, medical comorbidities or other medical conditions, smoking, other patient-related habits, and the location of that aneurysm. When we have decided that an aneurysm needs to be treated, there are essentially two options. One option is an open surgical procedure. And although this often raises a lot of concern, with new technology and advanced microsurgical techniques, that aneurysm can be treated very safely via what's called a craniotomy, or a part where we make an incision and remove a small window of bone to get down to the aneurysm and put what's called a clip, which is a small titanium device that closes off the aneurysm. The other option for treating an aneurysm is to do what we call a coiling procedure. A coiling procedure is where we go in through a small incision in the groin into the blood vessel and put a small tube up into the blood vessels of the neck and subsequently up into the blood vessels of the brain. This allows us to then put a small tube into the aneurysm itself and fill the aneurysm with a type of metal device called a coil. That coil fills up the aneurysm with metal so that blood cannot get into the aneurysm. One of the most common questions I get asked is an aneurysm rupturing a stroke? And although an aneurysm rupturing or a subarachnoid hemorrhage is a type of stroke, most commonly when people refer to a stroke, they are referring to what is considered an ischemic stroke, and that is where a blood vessel going to the brain gets blocked. So if you or a loved one has been diagnosed with an aneurysm, one of the biggest concerns is that the aneurysm could rupture. When an aneurysm ruptures, this is something called a subarachnoid hemorrhage. Subarachnoid describes the location in the brain, that is the fluid space around the brain, where the aneurysms are contained. Unfortunately, that often comes with a significant risk of either death or significant neurologic problems such as weakness, speech difficulties, or other stroke-like symptoms.